Hi, this is Peter with Physical Therapy TV. In this quick video, we're going to discuss rotator cuff injury exercises. More specifically, tests that are done for a rotator cuff injury and some things that you can do about it if you suspect that you have a rotator cuff injury. Just some basic anatomy. Many times a rotator cuff injury or rotator cuff tear could be confused with a bursitis or a tendonitis or inflammation of the rotator cuff tendon. So it's very important to get a distinction on specifically why that is, and we'll show a couple of ways that doctors and therapists use to identify and make a distinction about the specifics of your shoulder injury. This is the rotator cuff tendon. Many times when this gets torn, this should be attached to the bone. So many times due to either a severe trauma to your shoulder, you fell funny on it, or you were part of an accident, or over time you have a bone spur that could cut into the tendon. This can cause a tear, and it's important to figure out why. There's some manual tests aside from pictures that the doctor can take, such as MRIs or X-rays, which is the following. An impingement test is where the shoulder gets depressed, the practitioner lifts the arm up to the ceiling, and when you feel a sharp pain in the shoulder joint when the arm is elevated and externally rotated, this usually many times indicates an impingement on the rotator cuff tendon or bursa. The drop arm test is very useful. It's a quick way to assess the integrity of your rotator cuff. Your arm is elevated up to about 90 degrees and then suddenly let go. If you can hold your arm up in that position when the practitioner lets go of your arm, many times it indicates a rotator cuff tear. So what can you do? It's important that you get an accurate diagnosis. That's the first step. You can skip this because you can hurt yourself if you don't clear this hurdle first. Then it's important, after the diagnosis is made, to get the right course of treatment. Obviously, by improving your muscle balance, flexibility, and strength of your rotator cuff muscles and the adjoining muscles around the shoulder. This is crucial for long-term health, because what you want to do is avoid a rotator cuff tear at all costs. We have some more helpful information over at theshoulderreport.com. That's the website link, or below this video you can just click on the link and you can learn some more information if you are dealing with shoulder pain and you need to do something about it. Thank you so much for watching this video. We appreciate your time.